Welcome, everyone. Today's presentation focuses on cardiac diseases, with particular emphasis on the laboratory perspective. As medical laboratory science students, your role is essential in the diagnosis, monitoring, and management of patients with heart disease. This session will help you understand how laboratory results directly support clinical decision-making in cardiac care. Cardiac diseases are among the leading causes of morbidity and mortality worldwide. They include a wide range of conditions such as ischemic heart disease, heart failure, arrhythmias, and valvular disorders. While clinical symptoms and imaging are important, laboratory testing plays a critical role in confirming diagnoses, assessing disease severity, and monitoring treatment outcomes. Risk factors for cardiac diseases can be divided into non-modifiable and modifiable categories. Non-modifiable factors include age, sex, and family history. Modifiable factors include hypertension, diabetes mellitus, dyslipidemia, smoking, obesity, and physical inactivity. Laboratory testing helps identify and monitor many of these risk factors, particularly through lipid profiles, glucose testing, and other biochemical markers. Ischemic heart disease occurs when there is reduced blood flow to the heart muscle, usually due to atherosclerosis of the coronary arteries. This can present clinically as angina or myocardial infarction. Laboratory investigations are essential in confirming myocardial injury and assessing cardiovascular risk, especially through cardiac biomarkers and lipid testing. Laboratory markers in myocardial infarction. Cardiac biomarkers are central to the diagnosis of myocardial infarction. Cardiac troponins, specifically troponin 1 and T, are the most sensitive and specific markers of myocardial injury. CKMB is useful in detecting reinfarction due to its shorter duration of elevation. Myoglobin rises very early after injury but lacks specificity, limiting its diagnostic value when used alone. Heart failure is a condition in which the heart is unable to pump sufficient blood to meet the body's metabolic needs. Patients may present with symptoms such as shortness of breath, fatigue, and peripheral edema. Laboratory markers such as BNP and NT-proBNP are valuable for diagnosis and monitoring. Renal function tests and electrolyte measurements are also important, as they are affected by both the disease and its treatment. Arrhythmias refer to abnormalities in heart rhythm, including tachycardia, bradycardia, and irregular rhythms such as atrial fibrillation. Laboratory investigations help identify underlying causes, particularly electrolyte imbalances, such as abnormal potassium or magnesium levels. Thyroid function tests and therapeutic drug monitoring may also be necessary, as these factors can contribute to rhythm disturbances. Valvular heart diseases involve dysfunction of one or more heart valves, resulting in stenosis or regurgitation. Laboratory tests are used to assess cardiac strain through markers like BNP, detect infective endocarditis using blood cultures, and monitor coagulation status in patients receiving anticoagulant therapy. These results support both diagnosis and long-term management. Disorders of lipid metabolism are major contributors to cardiovascular disease. Elevated LDL cholesterol and triglycerides increase the risk of atherosclerosis, while HDL cholesterol is protective. Laboratory measurement of lipid profiles is essential for cardiovascular risk assessment, prevention strategies, and monitoring the effectiveness of lipid-lowering therapy. In addition to cardiac-specific markers, several other laboratory tests are relevant in cardiac disease. C-reactive protein and high-sensitivity CRP indicate inflammation and cardiovascular risk. Homocysteine is associated with endothelial dysfunction. HbA1c reflects long-term glycemic control, which is closely linked to cardiovascular outcomes. Renal function tests are important due to the close relationship between heart and kidney disease. Consider a 55-year-old male presenting with chest pain. Laboratory results show elevated troponin and CKMB levels, indicating myocardial injury. The lipid profile reveals a markedly elevated LDL cholesterol level, suggesting underlying dyslipidemia. A mildly raised BNP may indicate early cardiac strain. This case highlights how laboratory data are integrated to support the diagnosis of acute myocardial infarction and identify contributing risk factors. In summary, cardiac diseases are complex and multifactorial, requiring a combination of clinical assessment and laboratory investigation. Cardiac biomarkers, lipid profiles, electrolytes, and additional biochemical tests are vital for accurate diagnosis and patient monitoring. As future medical laboratory scientists, your role is critical in ensuring reliable results that directly impact patient care and clinical outcomes.
Thank you for watching MLS Lab Learners. If you found this video helpful, don't forget to like, subscribe, and share. Keep learning, keep growing, and we'll see you in the next lab lesson.